Welcome to the Thinking in Physiology audio course. In this chapter, we're going to learn about the language of the body, because before you can understand the body, you need to be able to understand the language behind it. Today we're going to talk about anatomical terms and directions like anterior and posterior and planes of the body. The reason that we need to do this is because precise language is important when we're handing over patients to different medical professionals. So for example, if you say something like below the ribs or to the side, that can mean very different things. Where if you're using precise anatomical language, it makes it a lot easier to do your assessments. If you want to follow along, you can always get the digital workbook that goes with these classes. You can find the link in the description below. Let's get started. Chapter 2, the language of the body. Before we talk about cells, organs, or disease, we need a shared language. In EMS, clear communication matters just as much as clinical skill. When you describe a patient, give a handover, or document care, the words you use shape how others understand what's happening. Anatomy has a specific language for a reason. It removes confusion. The first rule of this language is that everything is described from a standard starting point called the anatomical position. The anatomical position means the patient is standing upright, facing forward, arms at their sides, palms facing forward. Even if your patient is lying down, seated, or upside down in a vehicle, anatomical descriptions still assume this position. This keeps everyone on the same page. Left always means the patient's left. Right always means the patient's right. Without this standard, descriptions become unreliable very quickly. Directional terms build on this idea. These words describe where one structure is in relation to another. When we say something is anterior, we mean it's toward the front of the body. Posterior means toward the back. Medial means closer to the midline, while lateral means farther away from it. Superior means above. Inferior means below. Proximal means closer to where a structure begins, and distal means farther away. These terms aren't meant to sound technical. They exist to be precise. Saying pain on the outside of the leg near the knee can be interpreted differently by different people. Saying pain on the lateral aspect of the distal femur is specific. In EMS, clarity matters more than sounding simple. Next are body planes. Body planes are imaginary slices that help us describe location, movement, and injury. The sagittal plane divides the body into left and right. The frontal plane divides the body into front and back. The transverse plane divides the body into top and bottom. These planes help us describe injuries, understand imaging, and explain how the body moves. For example, when a patient bends forward, that movement happens in the sagittal plane. When a patient is cut horizontally across the abdomen, that injury is described in the transverse plane. You may not say these words out loud often, but understanding them helps you interpret reports, imaging, and medical conversations more accurately. The body is also divided into regions and cavities to help organize assessment and communication. Regions describe surface areas of the body. The chest, abdomen, pelvis, and extremities are common examples. More specific regions include areas like the right upper quadrant of the abdomen or the anterior chest wall. These regional descriptions help narrow down where problems may be coming from. Cavities describe spaces inside the body that hold organs. The cranial cavity holds the brain. The thoracic cavity holds the heart and lungs. The abdominal cavity holds digestive organs. The pelvic cavity holds reproductive organs and the bladder. These cavities matter because problems in one space often affect everything else inside it. In EMS, understanding cavities helps you anticipate problems. Bleeding into a closed cavity can be life-threatening even when there's no external bleeding. Pressure inside a cavity can impair organ function. When you know what lies where, you can think more clearly about what might be happening beneath the surface. This language may feel formal at first, but its purpose is practical. It allows EMS providers, nurses, physicians, and surgeons to communicate without guessing. When everyone uses the same words to describe location and direction, patient care becomes safer and more efficient.
You don't need to memorize every term all at once. What matters is understanding why this language exists and how it creates clarity. As we move forward in the course, these terms will come up naturally, tied to real anatomy and real patient presentations. Over time, they'll stop feeling like vocabulary words and start feeling like tools.
Well, that wraps up this lesson. If you're working through the course, you can click the top tile to go to the next chapter. And don't forget to get the digital workbook that goes through every one of these chapters so you can actively learn them. The link is in the description down below. We'll see you in the next class.